Boothby. I'm here to speak with you about the importance of the flu vaccination in your healthcare workplace. I have a statistic from the CDC, and they stated that up to 20% of Americans get the flu each year. More than 200,000 people in the U.S. are hospitalized each year, and about 3,000 to 49,000 deaths are flu-related. These statistics would decrease if more people took advantage of the opportunity to prevent the flu with an influenza vaccine or a flu shot. Now, as healthcare providers, we are constantly surrounded by patients that are at a high risk for developing the flu. Therefore, we have an increased chance of developing the flu or spreading the virus to our work setting or family members. Our best defense against the influenza is to receive the annual vaccination. Now let's talk about the flu for a second, like what it is, what are some signs and symptoms, and how do you diagnose it. The flu virus is transmitted through droplets in the air. It can be directly transmitted when someone infected coughs or sneezes in your vicinity. You can indirectly transmit the virus through contact with those droplets that land on inanimate objects. Now, initially the flu may seem like the common cold, with signs and symptoms of a runny nose, of sneezing, and a sore throat, but the cold usually develops slowly, whereas the flu tends to come on suddenly. Now, some common signs and symptoms of the flu include fever that's over 100 degrees Fahrenheit, aching muscles, especially in your back, arms, and legs, chills and sweats, headache, dry cough, fatigue and weakness, and also nasal congestion. Now, some diagnostic tests. The flu is mainly diagnosed by signs and symptoms, but for a more definitive diagnosis, the doctor may order a rapid influenza diagnostic test. Now, some preventative measures. The vaccine is not 100% coverage, so you can decrease your chances of catching the virus by thoroughly washing your hands and making sure you are properly washing between patients to decrease cross-contamination. You can also contain your cough and sneezing to decrease transmission. Now, there are some contraindications when it comes to the flu vaccine. Those contraindications include a severe allergy to egg products, a reaction to a previous flu vaccine. If you have ever been diagnosed with Guillain-Barré, you need to speak with your physician before receiving the vaccine. And also, if you're currently ill, you'll have to hold off on the vaccine and come back when you're well. Now, the injection is in the deltoid muscle of the upper arm. There will be some soreness at the injection site for about 1 to 2 days. This can be relieved with over-the-counter medications or warm compresses. Now, ultimately, the decision is up to you to receive the shot or not. It is at no cost to you at our facility, so please help yourself, your workplace, and your family to prevent the flu.